Hey YouTube, it's your boy Kenrick here again, aka the Optometry Prodigy. And guys, I'm coming at you this week with another video. Thank you guys so much for the support on all the other videos. But guys, this week we have a special feature here. But before I introduce her, guys, I want to make sure that we remember Diabetic Eye Disease Awareness Month. It's this month, November. We also recognize World Diabetes Day on November the 14th that passed, guys, and we just want to share, public education concerning diabetic eye disease. And to do that, guys, we would be looking at her project, and actually her name is Miss Sonali Simbhu. She's a final year optometry student like myself, and she'll be graduating with the class of 2020. So Sonali, just give us a background on what exactly the project was on.
Hello everyone. So this project was based on investigating the correlation between proliferative diabetic retinopathy and the duration of diabetes. So what we wanted to see in this project is if the longer that you have diabetes, if it had an effect on developing or running the risk of having proliferative diabetic retinopathy or diabetic retinopathy on the whole. So from the project, what we gathered was that after we conduct the screenings and the data was analyzed and stuff, it showed that the longer that you have diabetes, the longer that the patient is diagnosed with diabetes, it increases the risk of having diabetic retinopathy.
Okay, great. So guys, just to get a little more detail on the project, we'll go through now our presentation with Miss Simbhu here, and we'll get a little more details on terms of the project and what the outcome was.
Hello everyone. My name is Sonali Simbhu, and I'd just like to touch on my research project done on investigating the correlation between proliferative diabetic retinopathy, PDR, and the duration of diabetes. So the research question basically was, what is the correlation between proliferative diabetic retinopathy and the duration of diabetes? The hypothesis was that a longer duration of diabetes results in a progression of diabetic retinopathy. So, diabetic retinopathy, what is that? It is a diabetic complication that affects the eyes. So, it is one of the leading causes of visual impairment in patients with diabetes. Diabetic retinopathy is caused due to uncontrolled high glucose level in the blood, leading to damage being done to the tiny retinal blood vessels. So, diabetic retinopathy can be classified into non-proliferative diabetic retinopathy, NPDR, or proliferative diabetic retinopathy. With non-proliferative diabetic retinopathy, there are certain changes that we look for at the back of the eyes. So this is now the onset of diabetic retinopathy. With proliferative diabetic retinopathy, the blood vessels become leaky to blood and fluids, which will be seen as hemorrhages at the back of the eyes or on the retina. So in this picture here, the first one is R0. So we used a UK grading scheme where we classified each signs under R0, R1 being mild non-proliferative diabetic retinopathy, R2 moderate NPDR, and R3 PDR. So the first picture shows no diabetic retinopathy, as there were no signs that the diabetes were affecting the eyes. So those will be classified as R0. Mild non-proliferative diabetic retinopathy, these are certain changes that we will look for at the back of the eye. With moderate NPDR, there will be more signs that we look for. And to classify as R3, we would finally see that there are hemorrhages at the back of the eyes. So the methodology used was, this study was conducted using a total of 100 patients from the Trinidad Eye Hospital Diabetic Retinopathy Screening Program. An efficient screening along with the fundus photos was done prior to collection of the data. All data retrieved from Trinidad Eye Hospital database were then entered using the IBM SPSS statistical software, and certain tests were done, such as the one-way ANOVA as well as chi-square test was done to determine the correlation between the duration of the diabetes and the progression of diabetic retinopathy through grading of the photographs taken. So, from the results, what we gathered was that 17% of the patient had a duration of between 0 to 5 years. 18% of the patient had a duration of diabetes within 6 to 10 years. 23% had diabetes within the range of 11 to 15 years, and 28 of them were more than 16 years. 14 of them were unsure of how long that they had diabetes for. This pie chart here shows the percentage of the diagnosis within the first 100 patients. So from the pie chart, we can see that 40% had no diabetic retinopathy. So this states that the diabetes will not affect in the back of their eyes. 38% of these patients had NPDR, and 10% had PDR. 12% of the photographs were ungraded due to certain circumstances. So now we want to see the correlation between PDR and the duration of diabetes. So what we found with each grade there is a mean duration. So from the table above, we can see that R0 had a mean duration of 8.77, R1 had a mean duration of 17, R2 had a mean duration of 18.6, R3 had a mean duration of 25.33, and those that were ungraded were 10.81. So these values were then plotted on the graph shown below. You can definitely see that as you go up in the amount of years that the patient has been diagnosed with diabetes, you can see that it increases the risk of developing proliferative diabetic retinopathy. Also, we know that there are other factors that influence diabetic retinopathy. So for instance, ethnicity and diabetic retinopathy. We wanted to see if there are differences between each ethnic group. So in this table above, we had East Indian, African, and other. That's how we categorized. So the data in this table above was represented in this graph below here. And you can definitely see that ethnicity had a part to play in the diagnosis of diabetic retinopathy. However, there were no link that shows that ethnicity will increase the rate of the progression. So in conclusion, there's a correlation between proliferative diabetic retinopathy and the duration of diabetes. Therefore, a longer duration of diabetes results in the progression of diabetic retinopathy. And then lastly, there were no associated correlation between ethnicity and the progression of diabetic retinopathy. Therefore, we can safely say that ethnicity is not a defined risk factor for the progression of diabetic retinopathy. This project would not have been accomplished without the help of Dr. Ronnie Bowler and the entire team at Trinidad Eye Hospital. So thank you to Ms. Leanne Lazarus from the Trinidad Eye Hospital Diabetic Retinopathy Screening Program, who assisted me in learning the ways that they conduct this screening. Thank you to Dr. Boringa, the principal investigator of this study, and thank you to Dr. Shamjit Singh, who helped with the data analysis of this study.
Okay guys, that was a great presentation there by Ms. Simbhu. And what we're going to do now, just a small discussion, and I'm going to ask her a few questions based on the project. I know what we know about diabetic eye disease. One of the things you mentioned, Sonali, was that the duration of, the PDR, it actually affects the risk of getting it. Mm-hmm. What other risk factors besides duration do we see in diabetic eye disease?
Okay, so you have factors that are modifiable, like let's say smoking, mm-hmm, or controlling your blood glucose level or your blood pressure and your diet. So those are some risk factors that are modifiable. You could change this, you could fix, mm-hmm, this, right? Some that is non-modifiable will be the duration of the diabetes. Mm-hmm. It could be your age, yeah, and also pregnancy and your ethnicity.
Okay.
Right? Yeah. Any other question?
Okay, great. And do we know if the duration, we know that from your project we can see that it affects proliferative diabetic retinopathy. Mm-hmm. Do we know if it also affects non-proliferative diabetic retinopathy?
So yes, it will affect your non-proliferative diabetic retinopathy if you do not control the factors that you, mm-hmm, can't control, like controlling your blood glucose, taking precautions with your diet, and everything like that. So if you are diagnosed with diabetes, mm-hmm, and let's say you reach a stage of non-proliferative, and if you take care of your blood glucose level from then, you would not run the risk of getting proliferative diabetic retinopathy.
Okay, so the risk is basically reduced in that aspect.
Yes.
Okay, perfect. In terms of the grading schemes, mm-hmm, or classifications, we know there are many around the world used, especially the EDTR system. What grading scheme did you use in terms of this project?
All right, so for this project, we used the UK-based diabetic retinopathy grading scheme. So each patient comes in, we take a general history of the patient, mm-hmm, then they took a picture of the external structures of the eyes and the internal structures. So what they did, when you take the picture or the fundus photo, then we follow the grading scheme. Okay, so from the grading scheme, we have R0, R1, R2, and R3. R0 would be that there's no diabetic retinopathy. Basically, the diabetes is not affecting the eye, so that would be R0, right? R1 is background or non-proliferative diabetic retinopathy. R2 is also non-proliferative, but there are certain features that we look for to grade them under R1, R2. And then R3 is totally proliferative diabetic retinopathy.
Okay, great. Overall, what is one thing you would say to a diabetic patient out there?
Right. So one thing I would say to a diabetic patient is that once you have been diagnosed with diabetes, make sure and do a yearly eye exam. Also, it is mandatory to control your blood glucose level. So if it is that you could check your blood glucose level on a daily basis, record it in a book if you have to record it.
Okay, perfect. Okay, so guys, so as you can see, a lot of information there out on diabetic retinopathy. I would like to thank Miss Sonali Simbhu for doing this video with me. Guys, we have a lot more features coming soon. You guys stay safe, take the information, share it around. I'm out, guys. Peace.